Dr. Kourakin, tell me about a particular situation which we patients run into it, and that is missing teeth. You see, when we people have a missing tooth, especially when we have one missing in the back, we're not necessarily too anxious of fixing it because, frankly, it doesn't seem to be any big problem. The first week or so, it's a little uncomfortable. We see some difference, but then we get used to it, and it's kind of, so what? Why spend $1,000 or more to fix that whole thing? And yet, dentists like you keep telling us all havoc will break loose. So where does this difference come in? Can you shed some light on what's going on with missing teeth and what's your feeling of the importance of replacing it? Is it always needed? Is it sometimes needed? Tell us a bit about it.
Helmut, replacing missing teeth, I think, is absolutely critical to anyone's health because you have to remember it's not just dentistry that we're talking about here. We're talking about your overall medical health. Digestion or chewing starts in the mouth, and that's where the whole digestive process begins. Chewing your food correctly and then allowing your stomach to work on the bolus of food from that point, and your digestive system taking the nutrients in your body feeds your body. And we need to break down that food in the mouth first so that we don't tax our body, so we don't tax our stomach, so we don't tax our digestive system, our intestines here. And people don't understand quite often that if we make our stomach do too much work and our intestines do too much work, later on in our lives, we're going to have a difficult time with our digestive system. Ulcers and various intestinal problems are going to start to creep up simply because we never chewed our food correctly. Maybe because we didn't have enough teeth, maybe because we were too quick to chew, the bite was wrong, we were too much dental pain, our gums were bleeding. For whatever reason, people would just swallow their food in big boluses there. Totally not healthy for the digestive system. So it's so critical for the reason of digestion to have back teeth.
Because obviously fixing a stomach ulcers at the age of, 40, 50, or 60 is a lot more difficult than, and it's almost, you cannot fix it anymore. Once that stuff is there, it's very difficult. Tell me something, how much truth is to it that, like, when you have a missing tooth, you did mention very well the chewing part of it, and we do learn in school about it. And then again, my wife is still chewing her first bite, and I have my steak all the way down already. And she keeps telling me that something is wrong with me. But and so, what about the fact that some people tell me that one missing tooth, because it's not supported, it starts acting like a crowbar and pushes other teeth to side, and then your whole mouth starts kind of like becoming like a big old farm fence, which is like not nice to look at anymore and not very functional. Is that true also or not?
Helmut, this is the principle of entropy. Everything in the universe is going to break down, and it is a domino effect there. Missing one tooth, for instance, in the back region will allow an opposing tooth. Let's say you're missing a bottom tooth. The upper tooth will then drop down into the space where the lower tooth is missing. The tooth behind it will then shift forward, and that will tip. It doesn't move vertically. It will actually tip, and then that will allow the tooth above that to drop down further. And things will not move in straight lines, but they drift. And as the teeth drift, then we develop spaces between our teeth. We have spaces between our teeth. Food collects in there. Who likes to floss? People don't like to floss. Well, if you're not flossing, you have more spaces between your teeth. Now it's a double-edged sword that's really going to make your dental problem even more of a maintenance headache.
Right. Well, you said the word headache now. I can definitely see that, and you have mentioned in some other videos about the devastating effect of gum disease, not just about losing teeth, but also about really creating systemic problems in the body. And, people should probably go there and look at it to find that out. But, so you just said headache. Actually, some of your doctors do say that when you have too many missing teeth, there's other reasons also, but when what you call the bite is not arranged, and then the hinges here, which has been said as the most important hinge in the body, that they get out wacko. And I'm a mechanical machinery engineer. I can think without wacko things that eventually that stuff comes to a grinding halt. Is it true that because of that people have shoulder pain, neck pain, and even cruciating headaches and migraines, and it sometimes can be fixed with as simple as adjusting the teeth correctly?
That is correct, Helmut. If your bite is off, we can develop TMJ problems, and TMJ problems are predominantly found in females, but men too suffer from TMJ issues. TMJ issues can lead to migraine headaches, and we've treated many patients that do come in to our office after they've seen neurologists, psychologist, every kind of doctor imaginable trying to get relief.
Chiropractors probably, podiatrists and physical therapists and all that.
Physical therapists, massage therapists, acupuncturists there, all sorts of different holistic, treatments that they've attempted. And they come into our office and we diagnose them with TMJ. We make them a bite plane, and in 2 weeks' time, 80% of their symptoms have been eliminated.
Okay. Now, let me ask you something, Dr. Kourakin. Let me ask you something, because, we're talking about missing teeth here, and I don't want to go away from it. Can missing teeth, the way you described it, that they're not linear, but in all kinds of directions start creating havoc, can they create such a headache problem? Yes or no?
Absolutely, unequivocally. Teeth that are not going to be in alignment correctly are like gears that do not mesh but rather grind. And as our jaw attempts to move smoothly, and our jaws should move smoothly, and the gears need to mesh correctly there. If they're out of alignment there, then we are going to have these gears grinding, the muscles move unevenly, the jaw begins to click and pop, because the muscles are connected to our top of our head, our temporal region here. The next thing you know, we're getting these muscle spasms in through this region. We get muscle spasms that, create a pain that's going to originate in the neck region. The migraines develop, the muscle spasms, the tightness in the upper shoulders. And it's really incredible that how this is all connected from the shoulders up. People just don't understand how our skeletal muscle system is so interconnected, and this is, as you had said, Helmut, such a critical joint, such a critical point there, critical point of function, a focal point.
Wow, it is actually incredible. I guess it makes us thinking that whoever created us, let's call that guy God for a little while here. He has this head. He put the brain in it, relatively important to us. Eyes, we like them. Ears, nose. So what makes us thinking that those teeth are any less important? He packed a whole bunch of pretty good things in there. Grant you, the rest of the body is not so unimportant, and it's really a matter of the most important part in anything is the part which doesn't function. So basically what you're saying is, if a person has had headaches, has tried chiropractors and all those things, and maybe they worked, but it came back and all that stuff, and if he hasn't seen a good dentist who knows how to fix TMJs, who knows what missing teeth, and there are other reasons why a mouth could be misaligned and have headaches, but missing teeth is one of them. So if he has headache, has tried something, it didn't work, or if he hasn't tried anything yet, maybe instead of going to a neurologist, not that those people don't have their value, but let's go to a dentist and see whether the very basic is out. Would that be a good suggestion to people?
Helmut, I'm going to make it an even stronger recommendation. I'm actually very disappointed quite often in the medical community that the medical community does not give more consideration to the TMJ joint. Too often they're so focused on their own area of expertise there that they limit their vision of what could be the patient's problem, and the last thing that they may consider, and they probably won't even consider it, is the TMJ. And sometimes it's the patient's own diagnosis that will bring them into my office there. That, as I said, they'll go to a neurologist, they'll go to a chiropractor, they'll go to a PT, they'll go to their general practitioner. And it's very disappointing that no one will mention TMJ to them. Go see your dentist. It is the most fundamental point of treatment. Nothing could be easier than to have a bite guard constructed. Think about CAT scans, MRIs, dye studies, medical blood tests, etc., etc. How invasive and how expensive are all these procedures? Going to the dentist, having a diagnosis made of a TMJ and having a simple bite plane manufactured is the least invasive, least expensive procedure, and many times gives the most incredible results.
Right. Well, unfortunately, we seem to be hard in learning that where it hurts or where the problem is not necessarily where the cause is. That's just a symptom. And you know the old saying, you give a carpenter something to fix and he will use a hammer and a nail. That's it. If I ask somebody to make a shelf, if it's a carpenter, I will use wood. If it's some type of metal guy like me, I will weld stuff together. If it's a basket weaver, he will make it out of weaving baskets. So what you need to do is go to somebody who is out of that and does it all or is big enough to say, look, it doesn't look like we have anything here. Go over there. Anyways, thank you very much. Very, very enlightening. I appreciate that, Dr. Kourakin.